How's it going? My name's Adam, and today I'm going to assess, evaluate, and rehabilitate the foot and ankle complex. I have my client Gabe here. Some common foot and ankle injuries include plantar fasciitis, Achilles tendinopathy, medial tibial stress syndrome, which is shin splints, and then ankle sprains. I'm going to perform a dynamic assessment. I'm going to have my client Gabe perform an overhead squat. So what I want you to do is raise your arms over your head, have your feet shoulder width apart with your toes pointed straight, everything in line, and then have your arms fully extended over your head. And then all you're going to do is squat down to about the height of a chair, and you're going to do it 5 times. So down and up is 1, you're going to do it 5 times. So from that, one thing I noticed going through the kinetic chain checkpoints, his toes came up a little bit on the squat on the way down. In addition, you could see his knees caving inward, which is knee valgus. So that's definitely something to keep in mind as I continue to assess my client Gabe. One thing I noticed is a little bit of pes planus, which is flattened arches. Leads to a little bit of the knees caving in. They call that hyperpronation, and that leads to increased anterior pelvic tilt and tightness in the hip complex, which is pulling the knees in, leading to some knee and hip dysfunction. Again, knees moving inward, knee valgus. This could lead to possibly overactive adductor complex, the biceps femoris, your TFL, gastroc, lateral, vastus lateralis. Possible underactive muscles could be the medial hamstring, the medial gastroc, the gluteus medius and gluteus maximus, as well as the anterior tib and posterior tib. Okay, so taking Gabe's dysfunction into account, 3 overactive muscles we're going to inhibit in stage 1 of the corrective exercise continuum: the lateral gastroc, the peroneals, and the biceps femoris. So, for the lateral gastroc, we're going to start using a foam roller. Start on lateral gastroc. I'm going to do the right first. So I'm going to cross over, go to my hands, lift up, slowly roll back and forth, holding on the tender area for 30 seconds. And that's 30 seconds. Switch to the left side. A little tender there, so I'm going to hold. Now for the biceps femoris, we're going to go back down to that same position. Foam roller under both legs. Come on back. Lift up, go to the hands. And same thing, holding that tender area for 30 seconds. For the peroneals, we're going to go to our side. Both legs on top of each other. We go here. Same thing. Roll back and forth, holding that tender area for 30 seconds. Switch sides, pretend that's 30. Go here. Step 2 of the continuum is the lengthening phase. So all we're going to do is we're going to static stretch the gastroc and soleus. So the first thing is we're going to find some wall space and put pressure on. You go here, go against the wall. I'm going to do my right gastroc first. So I'm going to put my left leg forward, my right leg back straight. I'm going to press against the wall for that 30-second hold. Pretend that's 30 seconds. We're going to switch sides. Okay, now for the soleus, it's going to be the same thing, that 30-second hold, or alternatively, 7 to 10 second isometric contraction with a 30-second hold. So for the soleus, same thing, finding that wall space. I'm going to do my right first. I'm going to put my right leg a little bit closer and bend it. I'll back up a little bit, give myself some space. Bend it. I'm going to press against the wall. That's soleus. Pretend that's 30 seconds. Same thing. Bend that leg. Press against the wall. All right, lastly for the biceps femoris, we're going to go to the ground. I'm going to do my right leg first. So I'll hold it up,
I'm going to grab the other side. I'm going to pull. Holding for 30 seconds or that 7 to 10 second isometric contraction. Pull again.
Activation phase of the continuum. We're going to focus on the gastroc and medial hamstring. It's going to be either 4 reps of increasing intensity, 25, 50, 75, 100, or 10 to 15 reps with a 2-second hold and a 4-second eccentric lowering. So for the gastroc, we're going to find some wall space for balance. I'm going to lift my left knee. I'm going to raise my calf. 2 seconds up, 4 seconds down. I'm going to switch sides. 1, 2, 1, 2, 3, 4. All right, and for the medial hamstring, it's going to be the same setup. We have that 2-second hold and that 4-second eccentric lowering. You're going to find the same setup, some wall space, and all we're going to do, just like a calf raise, you can do this either with band or have somebody resist. Hold for 2 seconds, lower for 4, switch sides. 1, 2, 3, 4. All right, so step 4 of the continuum is the integration phase. We're going to assume my client Gabe has progressed well through the first 3 stages. He's an athlete, he's a soccer player, he knows balance. This first drill is going to be the single leg reach test. So we have 3 cones set up. We're going to start in between all 3 of the cones. I'm going to start on my right leg. I'm going to reach to the first cone, come on back. I'm going to reach to the second cone, come back. We're going to go to the third cone and come back. And this is going to be 10 to 15 reps on each leg, very controlled. For this next drill, the integration phase, is a single leg balance reach. All we're going to do, make sure you have plenty of space. You can use a stool, you can use a bench, anything at a comfortable height. And all we're going to do, I'm going to do my right leg first, step onto the bench, and raise the opposing leg, maintaining balance. Coming back down, I'm going to do it with my left leg. Up, and down. Same rule of thumb, 10 to 15 controlled reps. One quick note, if the client cannot yet perform the single leg balance exercises, you can always regress to double leg balance exercises using equipment such as a wobble board or a Bosu ball. Just how we teach plyometrics, starting with both legs and then progressing to single legs, you can always regress in the integration phase, as it's important that the athlete returns to natural form.